The vision for authentic development is glad to be associated with this National Confederation of the World Tobacco Day. Mr. Chairman, representatives of various institutions gathered here, specifically Ministry of Health, Food and Drug Authority, WHO, the Ghana Revenue Authority, Ministry of Finance, development partners, civil society actors present, the media colleagues, you're welcome, heads of various institutions, students, teachers, and of course, ladies and gentlemen. I must say that we are happy to be associated, as I mentioned earlier, and we appreciate the opportunity to share a few minutes of civil society perspective on this very important day. Today is a day of deep reflection, progress that we have made, and review of actions towards the implementation and enforcement of drug control measures in Ghana. The vision for authentic development is of the view that our country is confronted with numerous social challenges which require our concerted efforts to enable us to overcome these challenges. A lot of efforts have been put in place to address these challenges already, and of course this includes the National NCD Policy and Strategy, the Public Health Act and Drug Control Measures, Drug Control Regulations, among others, which calls for all stakeholders to contribute significantly to the implementation. This way, we'll be able to uniquely overcome these challenges and achieve the United Nations Sustainable Development Goals. We must be excited about the journey we have made so far as we join the WHO, FCPC, and all others as they mark the 20 years of the existence of the Framework Convention on Tobacco Control. In fact, I must say that some of us are glad because we were part of the journey, and indeed, we are happy to see this day. However, let me mention that the greatest barrier to the implementation of the WHO FCTC is the same today as it was in 2003, way back 20 years ago. But specifically because of one particular entity, and here I mention the tobacco industry, their allies, their front groups, and people who front on their behalf. The passage of the recently passed Excise Duty Amendment Bill into an act was received with so much joy and excitement. This is because at least for close to a decade, no significant achievement was made around tobacco taxation. We are thankful to the Ministry of Finance, the Ghana Revenue Authority, the Federal Authority, Ministry of Health, and various CSO actors, the WHO as well, and the UNDP. And of course, our parliamentarians who passed the act into a law in March this year. We are grateful, of course, to the President, who, despite the pressure from the industry players, looked at the evidence and public health impact of taxation and gratefully assented to the act. So currently we have an act that is going to increase tobacco in the country. And indeed, I'm happy that we are gathered here with students because these taxes would increase, would help us to reduce the affordability, the accessibility and exposure of tobacco and other products among our children, young people, and the poor, and of course, to improve health and well-being of everyone. We are however happy about the increase of taxes. We are however, unhappy, and I repeat, we are however unhappy about the inclusion of taxes on electronic cigarettes. This is a huge public health concern across nations, and we appeal to the Ministry of Health to take the lead and to urgently ensure that we seek avenues to amend the act to prevent this from happening. We won't, as a country, be able to handle or manage the consequences of electronic cigarettes and other emerging tobacco products if we don't do anything now. The fate of millions of Ghanaians depend on all of us to act decisively to end the global epidemic of tobacco. It is important to note that Ghana had estimated 1,461 farmers as of 2005. And I'm happy that the mutual stood here and then also charged the Ministry of Finance, the Ministry of Health, to ensure that we provide alternative, livelihood to our farmers. I remember in 2014, I think the first African meeting was held in Ghana to look at alternative livelihood and how, as a region, we can contribute to reducing the menace of tobacco as a region. Unfortunately, since then, we haven't seen much with respect to tobacco farmers, how we engage them, how we are taking away, how we are moving them from, tobacco growing to other important or healthy food. So this event actually is a day that we need to reflect, because I know that we have pockets of growers of tobacco in the country, especially in the middle and the northern belts of this country. In Kefe, I don't know if I get it right, Kefe, town in the Port region specifically, tobacco growing is an active and is one of the main cash crop of the people in that particular region. So we need to be much interested in that. Let me see the development. Recently, let me say last month, from one of our partners, because in the education decided to amendment bill. Permit me to highlight some few recommendations. It is time for the government and all of us from the deadly industry guidelines and how its profits. Number two, to protect its attempts to decently force claim of harm reduction and the so-called smoke-free. They continue to market their force and illicit young people and children everywhere. Number three, currently has tobacco taxes. That Duty Amendment Act recently passed on e-cigarettes and other again illicit in the country, and for the purpose of cessation. The Ministry of Health should activate its conduct of officials in order to avoid conflict of interest situation when dealing with the tobacco industry. And here, when it's World Tobacco Day, let us stand together united and declare our commitment to prioritizing food and advocating for comprehensive control measures.